Hello, I'm Dr. Ruth Roberts, your pet's ally. I hope that you are well and life is going well for you. Got a couple of really interesting things to tell you about. And before I get to the main topic of today called supplement overload, I do want to mention that I am a presenter featured on Dog Care on Air, which is a new virtual conference that will be broadcasting on the 16th and 17th of November. And there's three presentations I'm going to use. If you've been following me for quite a long time, many of these topics you'll be familiar with. But the first one is using food to heal. The second one is a brief history of nutrition and pet food. And then the third one is a holistic approach to kidney disease, your best diet and treatment options. So check that out. There's going to be a lot of other wonderful presenters with a range of different topics available. So check that out, and here's the link where you can do that, and get some help and information on, I think they have dog trainers and all sorts of different approaches to helping dogs feel better. So all good stuff. So at any rate, what I wanted to talk to you about is supplement overload. Your dog gets a diagnosis, your cat gets a diagnosis, and then bam, you're stuck with this question in your head. Your conventional vet has told you something like, oh, all we can do is you can buy this bag of food, or maybe you can have this supplement, that kind of stuff. So you don't get a lot of direction. And so you go online and you do research because you want the best for your pet. And then, you buy these, and there's a lot of great options out there, but you'll buy these kits, so to speak, targeted towards the specific disease. And then before you know it, you've got 10, 12. I've seen one person come in with 30, their pet was on 30 supplements. And it was like, all this stuff looks good and sounds good, but many of them are cross purposes with each other in terms of either they're duplications of what's in the supplements, or one goal like homeopathic treatment, versus Chinese herbal focus or Western herbal focus, that kind of stuff. And so all of a sudden you've got the kitchen sink of stuff in there. And I've also seen several cases where they've actually ended up making their pets sick, and they didn't realize it. They've been doing something for a long period of time, and either the symptoms don't get better or new symptoms appear. And so there's a couple of things I want you to think about if you're using quite a number of supplements for your pet. One is to take a day of rest, and I think that this is a good thing for all of us, and it's something that I've incorporated, for me, for my pets. Mary Jo is doing this as well. We just kind of take Sundays off, and that way your body is able to kind of sort through things, and you can feel whether it's kind of helping, not helping. Do you feel better on the days you're not taking supplements? Then there's a major problem. And this is how I'll sort through whether it's time to shift things up. The second is that if you are looking at a supplement and it is proprietary, meaning it lists out the ingredients, but it doesn't tell you how much of which ingredient, that's generally not a good deal, because it's like, oh, there's all this good stuff in there. But in many cases, the doses that are available are just not effective. And so I'd encourage you to really avoid proprietary supplements, because a lot of times they include other things. They'll use more of the cheaper supplement and much less of the truly effective supplement. So for instance, in veterinary medicine for liver disease, we got into this whole thing on SAMe. And then finally, we reincorporated milk thistle. So to give you some history of this, where all of this came from is there was a study probably 30 years ago now in children with Amanita mushroom poisoning. And if you're not familiar with that mushroom, it's very beautiful but profoundly toxic. And it is almost always a death knell if you eat it and you're not able to get to help. So what they came up with, somehow they got to using milk thistle to help support the liver. And what they found was that children that took milk thistle like pretty quickly after they were taken to the hospital survived and they went home. So in veterinary medicine, we somehow twisted that around to using SAMe. And so for years, that's what your vet would tell you to give your dog or the cat, or if the liver enzymes were elevated. Well, it turns out that's not very effective. And there's a lot of other uses for it in terms of joint function, things of that nature. But in my patients, I never really saw a great deal of efficacy with it as far as improving liver function. So mood elevation, all of that, in dogs and cats, I just never really saw the benefit. And then Nutramax, who manufactures the supplement that most veterinarians recommend, which is Denamarin. I think that's the one that's the combo finally between Silymarin, which is the active ingredient in the milk thistle, and SAMe. This thing is a pain in the behind. You got to give it on an empty stomach and wait an hour or something like that before your pet eats and blah, 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 blah. And it didn't work that well. I mean, I had so many clients coming to me in practice that had been giving this for months, and the liver enzymes hadn't budged one iota. And when we switched to plain milk thistle that they could get at any health food store or drug food store, from a decent brand like Jarrow, something of that nature, bam, we'd see a decrease in the liver enzymes. So there's a great deal of, let's pull the active ingredient out of the plant-based material and use that as a supplement. And sometimes that works, but in many cases it doesn't. And the reason is that many plants, there's the thing that we think does all the work, but there are cofactors and other phytonutrients available within that plant that help that specific nutrient do its job more effectively. So again, there are specific situations where like curcumin, for many people, having just the curcumin molecule in a capsule is very effective. And I took that for a number of years and it wasn't working. So what did I end up going back to? Good old turmeric tea. And you got to get the fresh stuff for it to really work. So we're going to talk a little bit more about turmeric on the Crock-Pet Cooks community today as well. So if you've already purchased the Crock-Pet diet, or you're a consulting client and you've not signed up for that, let me put the link in here for you. We'll get you approved and all of that. And if you want to be a member of the Crock-Pet community, it's really simple. I put more effort in supporting the people that are supporting me to do the work that I'm bringing. But you just buy the Crock-Pet diet, or you do a consult with me, or any of the other digital products that we've got available, the kidney support, the gut health, that sort of stuff. So at any rate, so we're going to talk a little bit more about turmeric and using that, and it is a very effective herb, and that's the deal, is making sure you're getting something that's fresh. So that's just one example. There are many out there. And the biggest thing is, as I said, making sure that you know what is effective for your pet and what is not. So if you find yourself looking at your pet supplement counter and it's, got 10, 15, 20 things on it, sometimes that is appropriate. But if you've been doing that regimen for a long time, what I'd encourage you to do is to, 1, give your pet a break once a week, and yourself too. And then 2, if you've been giving something for a long time and you're not sure that it's effective anymore, then what I'd encourage you to do is go down to what you think is the bare minimum. So for me, what ended up happening, with all the various health issues I've experienced, I was taking, 20 different pills and just gobs of them, and many of you say this as well. You look at the pet's bowl of food and there's more supplements in there than there is food. So what I'd encourage you to do is decide what are the bare minimums. And what I would put on that list is your multivitamin, and hopefully it's holistic total body support, a fish oil, and or a probiotic. And I'd take everything else out and give it a few days and see how things are. Does your pet still have as much energy? Have any of the symptoms returned that you were using the supplements to ward off? Then decide which supplement is going to target that symptom most effectively and add that back in and give it 2 or 3 days. Are things better? If you're waiting 4 days in between things dropping out and re-adding it back in, you don't have to have that sort of 2-week uploading process, if you will. You should see a difference fairly quickly. If in 3 or 4 days you don't, then I'd pull it back out. Now, another thing you can do is muscle testing. And you can do this as a surrogate for your dog. And that's something I've been playing with quite a bit lately. There's several easy ways to do it. There's something called a sway test. And literally, you want to ask, basically, and you can decide who or what you're asking. But you want to ask, is this helping my pet? And you want to start off by doing something like false, so you know what false is and true is. So the sway test is literally, and let's see if I can do this on screen, is standing up and basically seeing, if you, and what I do is put the supplement here and I take a deep breath and I say, is this going to help me feel better? And if you move forward, that means yes. If you move backwards, that means no. So again, you want to test. My name is Ruth. So, and I'm not sure if you can see that small movement forward. I move back to center. My name is Mary Jo. And it's really kind of weird, and that's a very subtle change backwards and forwards. So there's your positive test. You're saying something that you know is the truth. Your positive test backwards for your test for negative for not the truth. You say something you know is not the truth. And so use that. So pick up each of the supplements and you can say, is this helping Fido? The answer's on the exhale. If you move forward, yes. Does Fido need this every day? No. Okay. Does Fido need this twice a week? No. Okay. Does Fido need this 3 times a week? So you can go through this and figure out what the appropriate dose is. And Belinda's asking, how about switching brands from time to time? Maybe. So the thing you do want to be careful of too when you're looking at the different brands, like, okay, this says 400 milligrams of milk thistle in it. Great, check, boom, done. The other thing you want to look at is what else is in there. Are there gums? Are there, is there soy oil? Is there a lot of rosemary in there? And that's used to help preserve freshness. So look at the things that the brand is adding in. And frankly, there's some validity in it, but I think if you choose good quality manufacturers, that you're good to go there. So that's kind of what I've got for you this week. Really work through what you're doing with your pet supplementation program. Now, the other thing that I've added to help you do that is in iPet's Ally, and there's a lot of confusion about, okay, what is this? And for you Crock Pet Cooks folks, we're going to go talk about that in a little bit. It is a different program. Right now we're introducing it for folks that are not Cook's members, it's $1 for 30 days of access. And one of the benefits that's included in it is the supplements that I know are effective and at the effective doses. And so in iPets Ally, what you can see is a listing of each of the supplements that I recommend along with dosing by weight category. So I hope that is helpful for you. This is an additional program on top of what we're doing in the Crock-Pot Cooks community, because I'm limited, as to how much time I've got and how much time I can help support people. And, and this, frankly, I got to pay the bills, right? We all have to. So it's a way to get more information. And what I'll be doing is next Monday is doing the first teaching in there. And what I'm going to talk about next Monday is emergency room visits. When do you absolutely need to go? What can you do at home for some really common problems to get the issue kind of calmed down? And in doing that, you'll be able to sort of put together an emergency kit. And there is in our free portion of the members area, there's a holistic health protocol that lists out what I recommend to kind of keep on hand at home. So that's what I've got for you today. We'll be back next week talking a little bit more about really cool stuff. And in the meantime, here's the link to go check out iPets Ally if you are not a current Crock-Pot Cooks community and have the Crock-Pot diet and that sort of stuff. If you are, and this is a good reason to go ahead and join or get a consultation at this point, now we're offering 3 months for $1 because you guys have been loyal to me, and I deeply appreciate that. So until next week, I'm Dr. Ruth Roberts, your Pet's Ally, and Crock-Pot Cooks folks, I'll be over there in about 10 minutes and we'll get started on all the questions you've got. Take good care. Thank you. Remember, your pet's best health starts in the bowl.